citizens and residents, the World Federation for Mental Health, in its quest to make mental health a global priority, designated October 10th, 2013 as World Mental Health Day. The organization recognizes that the world has an aging population. The number of persons who are 60 years and over are more than 800 million. By 2050, the figure will increase to over 2 billion. The organization therefore decided to address the growing concerns of an aging population. Hence, for this year, 2013, the theme as selected by the World Federation for Mental Health is Mental Health of Older Adults. This theme takes on even greater significance as the month of October is celebrated as the month of older persons. Older adults are faced with numerous health challenges. In addition, they lose the ability to live independently because of limited mobility, frailty, or other physical or mental health problems, and often require long-term care. Unfortunately, some are abandoned by their loved ones and often left by themselves, unattended, uncared for, and unloved. According to the World Health Organization's Department of Mental Health and Substance Abuse, it is believed that approximately 20% of adults aged 55 years and over suffer from some form of mental disorder, a problem that is usually under-identified by healthcare professionals and by older persons themselves. Those affected are often reluctant to seek help. In St. Kitts, 16 patients aged 55 years and over were admitted to the psychiatric unit in 2012. 6 were males and 10 were females. Among this group, 10 were admitted for the first time, while 6 were admitted 2 or more times. The demographic, social, psychological, and biological factors that contribute to mental disorders in older persons include the aging process, poverty, social isolation, loss of independence, lack of care, loneliness, and the empty nest syndrome. Older adults are also more likely to experience bereavements and physical disability that may affect their emotional well-being, resulting in a deterioration in their mental health. Older adults may experience maltreatment or abuse, even at home and in care institutions. This type of abuse includes physical, sexual, psychological, emotional, financial and material abuse, abandonment, and neglect. This often leads to depression and causes loss of dignity and self-respect, particularly as many older adults are too scared or are unable to report such abuse. The mental health of older adults can be improved through promoting active and healthy aging. As aging is a gradual process, there is much we can do to promote good mental health and well-being in later life. Older persons must be encouraged to participate in meaningful activities to stimulate the brain, to have strong personal relationships, and to maintain good physical health. We must identify and treat mental disorders as early as possible. Although medical interventions are a necessary part of the treatment, the involvement of families and communities is a critical component in restoring the mental health of older adults. They must be educated and encouraged to do more physical exercise, interact with the younger generation, keep socially connected, keep their brains active, reduce their weight, stop smoking, discontinue the harmful use of alcohol, control their blood pressure, blood sugar, and cholesterol levels by regular monitoring and the taking of prescribed medication as and when required. By so doing, we will continue to boost their dignity through social support and family interactions, thus lessening the impact of the aging process and improving the mental health and general well-being of older persons. The role of primary health, community care, and the social service sectors is vital in reducing abuse of older persons while promoting public awareness of and providing and soliciting support for the needs of the elderly. Close monitoring of care institutions is essential in ensuring that better services are provided for our elders. The number of older persons is growing fast the world over, and St. Kitts-Nevis is no exception. Life expectancy in St. Kitts-Nevis was at age 67 in 1990. It was 75 in 2012. The socioeconomic impact of such demographic changes is adding to the increase in mental disorders among older adults. I urge all of us, therefore, families, the church, the school, the communities, non-profit organizations, the private sector, to join in the fight to reduce the impact of this phenomenon and to fill the service gaps for older adults. Employers can contribute by implementing health promotion strategies in the workplace. And finally, I make a special appeal to individuals to recognize that engaging in healthy lifestyle activities is engaging in the positive development of yourselves, your families, your communities, and your country. The Ministry of Health invites you, the members of the general public, to visit the foyer entrance of the Joseph and France General Hospital from 8 a.m. to 3 p.m. on Thursday, October 10th, 2013, where you can learn more about the mental illnesses that are likely to affect older adults. Thank you, and God bless.